So Dominic is a normal 7-year-old kid. I mean, he has some problems like eczema and hypoglycemia, but it's nothing we can't control. We went skiing for Christmas in December to Colorado Springs, and we had a blast. I mean, the kids loved it. Everything was perfect. We came home, and that night, his eczema started flaring up, which is normal. We were in the snow, and it was fine, but it got really bad on his hand. We didn't think anything of it. The next morning, he woke up feeling really sick with a fever. It was a low-grade fever, like 100.7, but we gave him some Tylenol. He was feeling sick, like his head hurt, he was feeling a little dizzy, he was coughing. So we just took him to the doctor to make sure that he wasn't getting, an infection or a cold or anything. So we take him to his pediatrician, and the pediatrician gives him some antibiotics, and was like, okay, well, if he doesn't get better in a week, just bring him back. And that was fine. So a week comes and goes, and he's not getting any better. His fever is getting higher, and he's just not getting better. So we take him back to the pediatrician. The pediatrician keeps upping his dose of antibiotics to see if he'll get better. We go through this for about 2 or 3 weeks, and he's not getting any better. So a month later, his fever gets really high. It's at 103.6, and it's not coming down. We tried everything. We tried lukewarm baths, we tried Tylenol, we tried Motrin, we tried everything, and that child's fever did not go down. So we got a little scared, and we rushed him to the hospital. We get to the hospital, and they start him on IV fluids. They start trying to get his fever down. They start doing a whole bunch of stuff, and I'm like, okay, well, let me step back and let them do their thing. We're there for a couple of hours, and all of a sudden he starts complaining in excruciating pain and crying that his body hurts, his knees hurt, his wrist hurt, his elbows hurt, all his joints were hurting, especially his knees. He couldn't walk to the bathroom. I had to carry him everywhere. To sit up was pain, everything. And they started questioning themselves, why is he feeling joint pain right now?
Dominic came in on my shift, and he had a very high fever. Everything we did, it wasn't going down. And then he started complaining about his joint pain, and that just made me think, what is going on here? He's had a fever for a month now, supposed to be taking antibiotics, and it wasn't going down. And now he's complaining about his joints hurting. That isn't right. There has to be something else going on.
Okay, so the joint pain started, and it freaked me out. I mean, they started giving him pain medication to try to get rid of the pain, and it just wasn't working. 30 minutes later, everything took a turn for the worse. He got super lethargic. He was coming in and out until finally he completely passed out. He wasn't responding. He wasn't doing any type of movement. It was like he was just in a permanent sleep. We saw him breathing, but he just wouldn't respond. They hooked him up to monitors, and at that point, I knew that everything was going downhill. I was so scared that I was going to lose my son that day.
So now this is getting really weird. The child just passed out, and I just started asking questions. Have you gone out of the country? Have you gone out of the state? Have you eaten anything different, unfamiliar? Drank anything different or unfamiliar? Is there any other symptoms like rashes that you're not telling me about, because this is really weird and uncommon?
So the doctor comes into the room and starts asking me all these questions. Is there anything that I'm not telling her? She's asking me if we traveled outside of the state, outside of the country, if they've eaten anything foreign, if he's had any rashes. Well, hello, he has eczema. Of course he's having rashes. He always has rash. So I told her, I was like, yeah, he has rashes. He has eczema. There's, a rash that hasn't gone away since the trip that's on his hand, but I mean, it's eczema, it's always there. And then she was like, oh, what trip? What trip is it that you guys went on? And I told her we went to Colorado Springs to go skiing, We had a family trip in December for Christmas. That was it. And she started checking his hand for the eczema. She started checking the eczema, and then she started saying that she wanted to run more tests. She didn't tell me for what. She didn't tell me why. And I'm here freaking out like, hello, mother, why don't you fill me in?
So she said that they went on this trip to Colorado. I started checking Dominic. I see the rash on his hand, and it doesn't even look like eczema, which she says it is. There's a huge bite right in the middle. I don't know how she could have missed that. So I already have somewhat of an idea of what it could be, and I started running some tests just to clarify my hunch. And so I tested him for the ELISA test, which is the enzyme-linked immunosorbent assay. It tests for antibodies for the bacteria Borrelia burgdorferi, and sometimes it gives a false positive. So that's why I went ahead and did the two-step approach for the Western blot test, which tests for the proteins of the same bacteria. And it came back positive as well. So I just went ahead and did a third test called the PCR, which is a polymerase chain reaction test. And it detects bacterial DNA from the fluid extracted from the joints, since he was saying he had joint pain. And it came back positive as well. So all of these tests confirm that he has Lyme disease. This is when you get bitten by a deer tick, and it's more common in the summer, but we've seen some cases in the winter. And it's basically just the tick is infected with the bacteria, and then you get bit and you get infected as well. So the treatments are, it's an oral pill that you take. It's doxylin, and you can also take IV fluids of penicillin for more severe cases, and it should clear it
So
up.
yeah, it was Lyme disease. I didn't even care anymore. I was just happy that he was good. He was back awake again. They took him off the monitors. He was able to move without pain. I mean, he still had some of the symptoms, like the flu symptoms, a little bit of a low-grade fever, but he was doing good. They were able to send him home on more antibiotics, and he was getting better by the minute. I was just happy that he was home. Honestly, I didn't care about anything else. Last ski trip that we